Alrighty, thank you guys for braving the weather, the tough SoCal weather that we've got. Are you guys excited today to really hear some really interesting, cool things that can help us push forward in healthcare? Alrighty. So I'd like to just a quick note thanking Mark and Sunny and the planning team. This is all done by volunteers, so we really appreciate everybody that gets behind our chapter and really helps make a difference. All right, so before every event that we have the chapter president, I'm the president of HIMSS SoCal. We have to give our perfunctory 5-minute kind of state of the chapter. So I'm going to go ahead and do that. So just this will be kind of brief, but thank you guys for coming. So here is our board of directors, hardworking volunteers. So I'm not going to name them off, but a number of different positions, and I want to thank each and every one of these individuals for helping out. We do a number of programs every year, and if you guys are not aware of it, HIMSS Southern California chapter has won the Chapter of the Year award for all of the 54-something chapters in the HIMSS ecosystem, which is mostly in the United States at this point, although HIMSS is wanting to go global. So anyway, we've won it 3 out of the last 4 years, and it's because of hardworking volunteers and you guys. So give yourself a round of applause here. Upcoming events, we've got for those that are going to the HIMSS 15 Gala event in Chicago coming up in April. There's a block party on I think it's Monday, and then Tuesday afternoon from 4:30 to 6, we're going to be doing our combined Northern California and Southern California networking event, and that's going to be at the Imprivata booth on the conference floor. We've also got an exciting clinical informatics event coming up at UCI. Chuck Podesto's home court in mid-May, and then we've got tentative, we're looking at doing a combined NorCal, SoCal patient engagement conference, so it's kind of in the works. We've got National HIMSS really behind it. It's going to be actually mostly in Northern California, but we're thinking of doing a simulcast. Right now we're looking at using National University down in San Diego, their facility, to actually have the recipient piece of it, and so we can have you guys come if you're able to join in Southern California there. So, yeah, hear my voice a little louder. Okay, membership update. We are holding fast at around 2,200. Just an encouragement for those that do have organizational affiliate memberships. That means everybody in your organization, not just the IT folks, but also clinicians and the folks on the insurance side. There's so much related to technology and healthcare that we're finding it isn't just IT people that are interested in HIMSS. So anyway, you can give everybody a complimentary 1-year worth $175 membership. I think the challenge is, and I'm kind of working on that at Kaiser, we have 55,000 people in Southern California. Now, if I could just get a little slice of those guys to join the chapter. So the hard part is really getting them to actually click the link. But it's really simple. You could actually we can help you out with that, but all you need is a little marketing letter, send it out to all the leadership in your organization. And all they need to do is click on a link specific to your organization, answer a couple questions with their name, et cetera, and then they're in. So it's a way to kind of boost our membership. And so we'd like to blow the socks off of the membership of HIMSS in Southern California. So if I ask you guys, think creatively, be innovative on how you can get folks in your organization. If you have an organizational affiliate membership, to go ahead and sign up. If you don't, we can help answer some questions. It's actually a really good deal. All right, social media, we're continuing to move forward. We're finding that most of our, we're not competing with a lot of the organizations that are doing much better than us, but I think we're doing really good with our YouTube videos from our conferences, so we're seeing a pretty good read rate on those, or watch rate. Obviously, we need more Instagram followers. Wouldn't you guys say that? Okay. And then also I'd like to make, in closing here, a couple of notes about some other areas that we're working on. Advocacy, we did have a team go out to Washington, D.C. a couple times during this fiscal year. The last time we really lobbied hard with a number of congressmen and women and senators. We talked to their offices about cutting meaningful use, that attestation period down. And so actually we do believe we're one of the, it wasn't us that did it, but just the recent ruling on that is really, we feel like we're pretty happy about that we're making a difference. So your involvement in volunteer work can make a difference. Also, November, we had about 19 individuals that passed the HIMSS exam. We're also trying to reach for the stars with that and have the chapter with the most number of certified healthcare information professional, however that stands, have us kind of leading the nation in that. So we just did an event down in San Diego Friday, and so we had 6 people came, but hey, so anyway, they got the course. They didn't take the exam, but they're prepped and ready to go. I'm sure they're all going to pass it. And so we're working the college campuses, building relationships with our future leaders. So we've got a roundtable at UCLA coming up in May, and we are offering multiple scholarships if you're a full-time student and you're in a bachelor's or master's program or a PhD program, and the deadline for that is March 23rd. And we do need some more people to sign up, so it's free money that's out there. And a quick note about our finances. Yeah, so all of our events, this event, we're in the black, so that's good. We're not having to borrow from Uncle Sam or some other place, the big HIMSS organization. We did raise at our golf event in, I believe it was October, November last year. We raised $4,000, so I presented that check to the Make-A-Wish. Actually, they took a nice picture. I don't have it here to show you guys, but anyway, so we gave them $4,000. It was a very expensive golf course, and for us to actually get $4,000 in proceeds was really quite a yeoman's effort. So anyway, and that's going to go to a child that really is in a terminal condition. They actually told us the child that we would go to, and it's going to help them get a wish for something that they have really been wanting. So we're making a difference. And then we're looking, it's kind of late in the year, but we are looking for continued increase in our sponsorship. So if anybody out there is an organization that would like to take advantage of our sponsor opportunities here, you can see Angela or Adam. Angela, are you in the room? Okay, so there she is in the back there. All right, and otherwise, check us out. And so we have some various links and email addresses, et cetera, for you to get involved. All right, so that's it. I'm done. The Prez address is taken care of.